In pediatrics, because virtually everything is dose based on weight, virtually any medication could be appropriate for dose banding in pediatrics. But the ones that are probably a higher priority, where you get more bang for your buck, would be things that are a high usage, so you can find some efficiencies in the preparation. Things that have a wider therapeutic range, because there's more flexibility, so you can probably get away with your bands being a little bit wider and kind of maximize those efficiencies. So those would be the big ones that I would look for. So there's a couple different approaches for dose banding. Most of the literature for safety actually supports using weight-based bands. So no matter what dose the prescriber would intend to order, if you are a patient between this weight and this weight, you would be given the exact same dose. And this has had a lot of success in places like emergency departments, where a patient comes in and you are between 15 and 20 kilos, and so your dose of amoxicillin that you get prescribed is exactly this. A little bit of a different approach that allows for more flexibility in terms of a different weight-based dose if you'd like to do something that was a higher per kilo dose, if there's a range of doses for the indication, or if there's a lot of variability in the interval, is more of a dose rounding approach. So you would have set bands that a dose would round to depending on what the calculated dose is. There can be a lot of efficiencies found in dose banding, and it actually has good evidence as a safety initiative. So at the point of prescribing, it can reduce errors if you're using a weight-banded system. But there's also some support for it in terms of improving efficiencies, and perhaps pharmacy can prepare more products and there's less mixing at the bedside, which we know is always the preferred practice. So those are the benefits. The challenges tend to be a little bit more personal as opposed to systemic. So some prescribers don't like the idea of dose banding. They really value having the ability to customize dosing based on what they think is best for that particular patient. So sometimes it's more of a matter of socialization and buy-in than a true matter of clinical relevance. The Alberta implementation experience has been trying to get over 100 hospitals kind of onto the same program with two major pediatric hospitals. And it's been both prompted by and facilitated by the implementation of a province-wide clinical information system. And so that has been a bit of a double-edged sword in the sense that there's been urgency to preparing and implementing this, but it's been a great enabler in the sense that we've been able to hard code this into the system to kind of make it a forced function at the time of prescribing. So we've done some pre-implementation work, and that has gone generally fairly well. And so we are preparing to go live with it via the clinical information system first week of November. From pharmacists, I think that they like it in concept because we are doing it via paper-based implementation right now. It's a lot more work, and they are really looking forward to it being a forced function where it's being done at the point of prescribing so that there's less cleanup work to be done by pharmacists on the back end. So that's going to be a key enabler for it being a smoother process and less of a burden in terms of workload, is going to be having that burden shifted to the time of prescribing versus at the time of order processing. A lot of other areas do it, and I think that Alberta in a lot of ways has been a bit of a lag behind. And there's actually a fair bit out there in the literature, some great stuff by the WHO, and there are a lot of recommendations out there. So if other countries or sites are interested in doing it, I'd really encourage them to take a look around, because there's a lot of really great work being done, and you don't need to start from scratch. You don't need to reinvent the wheel. You can certainly find something that's working at another site and model it after it.